In 2019, I had something very, very suspicious happen to me that I didn't realise. That I woke up that morning and I couldn't see. Prior to that, I had flying saucers and spots between my eyes, literally. Awful, awful, awful times. Then that morning when I woke up and I couldn't see, my wife made an emergency call and spoke to Dr. Vasu, who then brought me in that morning very early and told me my retina was literally hanging off. I had major tests throughout the day, and in them tests he said, we've got to operate. So that evening we went down to the theatre. I was introduced to everyone very calmly, you know, because you are nervous and you can't get away from that. He done a major operation on my eye, over 4 hours, and then he told me very successful, and I was pleased with that. Over the next coming few weeks, I was in and out of hospital, obviously, to check my eyesight. And he done a marvellous job for me. And also the staff that was around at the time, they were absolutely brilliant. I had all the confidence in the world. And you must have the confidence in the world. Don't ignore no situations. He told me if I ignored that situation and left it for over 2 weeks, or a week, I would have had a major problem with my eye, but I didn't. And now I've got 90% of my eyesight back, 96% in fact. And so you must not ignore anything. Just go and get it done. And believe you me, you can't get a better hospital than this.
I'm Dr. Vasu Kumar, specialist vitreoretinal surgeon and head of the Department of Ophthalmology, NMC Royal Hospital, Dubai Investment Park. First of all, I would like to thank Mr. Peter for his kind words and for keeping his faith with us. So just to tell briefly about him, that he presented to us with almost complete loss of vision in his left eye, and we diagnosed him as a case of retinal detachment. So we planned for him 23 gauge minimally invasive vitrectomy surgery, and we were able to successfully reattach his retina. And subsequently, he was able to gain almost 6/9 vision in his left eye. So just about to tell that because of the advances in technologies and the availability of advanced machines, we are able to deal with more and more complex eye cases with gratifying results. So something very important which I wanted to talk about was about retina and retinal detachment, and what are its early signs which someone can pick up and can consult their doctor at an early stage. So retina is a layer of the eye on which all the images are formed, and because of retinal detachment, the patient loses his complete vision. So what are the early signs of retinal detachment? The most early signs are flashes of light, where a person sees multiple flashes or streaks of light going from one direction to the another in his vision. And secondly, floaters. So a person sees multiple floating objects, maybe of different sizes and shapes, like it may appear like insects or cobwebs in his vision. So on occurrence of any flashes of light associated with sudden increase in floaters, the patient should immediately consult his eye specialist, and definitely a retina specialist for that, for his eye checkup.